Hello, I am Dr. Dan Weisman, and I'm here to explain the Lean On Me peer support line here and requesting funding through Johnson Johnson Mental Health Initiative. Like I said, my name is Dr. Dan Weisman. I am joined by my colleagues, Dr. Emily Sinwell, Dr. Julie Stanek-Hutt, Dr. Teresa Bechtel, and Dr. Mary Dirks. I'd like to give you two scenarios in which you see nursing students coming to our university. First is a high school student who has worked hard, sacrificed, and has made the grade and has been accepted to our prestigious nursing school. They are on top of the world and excited about beginning their career as a nurse. The second would be a nursing student who has graduated, is working as a registered nurse, and has decided this is the right time to come back to school. And they apply for the nurse practitioner program and are anxiously awaiting that letter of acceptance in the mail. Once they get to college, they understand that the clinicals are going to be difficult and they're going to be stressed, but they're excited. They're learning from top-notch professors. They're getting great clinical experiences. And so even though they're working hard and they're learning a lot, they are under a great deal of stress to get up to the speed and understand the standards of being a nurse or nurse practitioner. Then around spring of 2020, the nurses discover that there is a virus traveling around the world. And unfortunately, this starts to disrupt their entire lives. Unfortunately, they start to see their campuses unable to be obtained because they have to be locked in their dormitory. Their clinicals are being put in jeopardy as the hospitals that they once were able to do clinicals are now being shut down and unable to be accessed for their clinicals. But they are still working, they're still providing care outside of their clinicals and seeing this virus devastate families and communities. We all understand that nurses are carrying the weight of the world on their shoulders. We also know at our university, at least 80% of nursing students are working on the front lines of COVID. They are caring for the sickest patients and putting their own health in danger. And it continues to be completely unclear about how much the pandemic will affect nurses and nursing students' mental health. We have all seen pictures of this in the news. We can see the physical scars of COVID, but we cannot see these emotional scars, the scars that they still continue to carry today, and that we will continue to carry throughout the years to come. According to a recent report, 25% of university students report severe depressive symptoms, and even 11% can have even considered suicide during this COVID pandemic started. And while the nurses care for the grievously ill COVID patients, they also worry about their own health, their welfare at home. Some of these students are adults who have families at home and are caring for them as well and worrying about taking that virus home. So there has to be a better way to support the mental wellness of these nursing students who, if they try to access the current mental health system, can take weeks and months to actually secure an appointment with a psychiatric mental health provider. And so we have to take care of these nursing students who are caring for our patients in our current pandemic and will be caring for our patients in our future pandemic. Where they can turn. The Lean On Me line is currently a peer support line where nursing students can call and speak to psychiatric mental health nurses 7 days a week from 6 a.m. to 11 p.m. With this funding, they will be expanded to include text messaging. Nursing students will be allowed immediate reach to a graduate nursing student who they can either speak to by voice or text, depending on their comfortability, and be able to speak to them at a moment's notice. The Lean On Me line will also connect them to a self-paced mental health wellness modules, and these modules will cover several topics which they can access at any time and come back whenever they need to. So let me give you a quick example of just how this texting could work. So a nursing student may text someone, "Hello, is someone there to talk to?" The psych mental health nurse practitioner student will reply, "Yes, how's your day going?" Nursing student, "Not so good, lost another patient today." Psych student, "Oh no, so sorry, how are you handling this?" Nursing student, "I thought they were getting better." Psych student, "This is such a shock, I know I've been there." Nursing student, "You have, how do you deal with it?" Psych student, "I think we all deal with these things differently, so I'm interested in how you handle this." Nursing student, "I'm not sure, my head is just blank." Psych student, "Routines can be our best friends right now. So what do you do normally after a shift?" Nursing student, "I usually drive home, eat, and unwind with some Netflix." Psych student, "That sounds good. Any homework due tomorrow?" Nursing student, "No, but I have midterms in 2 weeks. I should probably study some patho later." Psych student, "Maybe during this difficult time, you could consider just taking care of yourself after such a difficult shift." Nursing student, "Maybe." Psych student, "Know that we're here from 6 a.m. to 11 p.m., so you could reach out later if you needed to." Nursing student, "Okay, I got to get back to the floor. Thanks for listening." As you can see, the Lean on Me line can be countless at resource to nursing students who continue to put their lives on the line for the care of the patients that we are going through this pandemic. And they worry not just about their own health, but their ability to progress in their own academic endeavors. And so supporting these nurses and nursing students will be efforts in which we will provide the health and care and well-being of the person, where we understand mental health is no longer just a component of our whole health, but an integral part of it. So caring for our current nursing students will provide the health and well-being for both our communities, nation, and world to come. This proposed proposal has been in works for the number of months. Back in April of 2020, a needs assessment was established in which nursing students identified themes and priorities for support. One of them was a peer support modules in which they could learn asynchronously and this was developed as an evidence-based self-paced mental health wellness toolkit in which piloting testing indicated that 81% of students were actively engaged and reported reduced perceived stress. The Lean on Me line was also established in the fall of 2020, in which a voice 1-800 number was able to be reached out, and so students could contact them during distress periods. With the QuickFire funds, this will be expanded to texting through the Twilio platform that is currently here at the university. The Twilio protects privacy through HIPAA, as well as allows multiple clients to receive help simultaneously. So where the Johnson & Johnson Nurses Innovate QuickFire Challenge and mental health funding will actually go, it will actually support the information technology services in developing the Twilio platform into a text message servicing, as well as connecting the mental health toolkit into along with the Lean on Me line. It will also support faculty time in which a psych mental health nurse practitioner faculty is supporting and backing up the psych mental health nurse practitioner students during those calls or other periods. And there will also need to be ongoing maintenance of the mental health toolkit to make sure that it is current and up to date. And lastly, the funding will definitely go to support marketing, which we need to make sure that all nurses going through this program, both graduate and undergraduate, understand that there is resources that they can access immediately and that they aren't alone. Helping our nursing students today will be of great benefit, not just for our community and world today, but also for the pandemic that comes in the future. I hope I hear from you soon, and thank you so very much.